Hello, my name is Ashley Williams, and for this week's assignment, I will be discussing National Patient Safety Goals, and this is my audience. Alright, so in efforts to reducing errors within the healthcare setting, the Joint Commission has implemented the National Patient Safety Goals. These goals are guidelines that represent specific areas of concern and regarding patient safety. Some of these concerns are patient identification, communication, medication, clinical alarms, infection prevention, risk assessment, and surgery protocols. For this presentation, I will be discussing hand hygiene and infection control. So, why is hand hygiene important? For one, it prevents the spread of germs, it prevents contamination, and it also prevents hospital-acquired infections. How can hand hygiene improve patient outcome? It can reduce the hospital-acquired infections and reduce deaths associated with these hospital-acquired infections, as well as reduce the length of stay. Alright, so now I have a quick case study. Nurse Jackie put on proper PPE to care for John Doe in room 302, who was diagnosed with C. diff. While assessing Mr. Doe, her hip phone, which was attached to her scrub pants, rang and she answered it. Plain Jane in room 309 needed to speak with the nurse, but it was not urgent. Therefore, Nurse Jackie clipped her hip phone back to her waist and finished assessing her patient. Upon completion of her head-to-toe assessment, she removed her PPE while in the room, and then prior to leaving the room, she used the alcohol-based hand rub that was on the wall. When hand hygiene was complete, she headed to room 309 to assist Mrs. Plain Jane. So, let's discuss this case study. There are two areas where Nurse Jackie went wrong in trying to prevent infection control. Can anyone tell me one example?
She removed her hip phone. No, she answered her hip phone while she still had on her PPE, her gloves, gown, and then replaced it while she still had them on and continued her assessment.
Correct. Either she should have not answered her hip phone and finish her assessment, and then when she was done, try to see who it was. If she has one of those phones that has a call ID, she could have spoke with the medical receptionist and let them know what room that she would be in and that she would not be able to answer her hip phone to prevent any distractions and prevent any opportunities to spread any contamination. Or she should have removed her gloves prior to answering the phone. She was done with the phone. She should have used proper hand hygiene before putting it back on her hip and reassessing the patient. There's one other area where she breached the infection control. You may or may not know, but this resident has C. diff. And Nurse Jackie used the alcohol-based hand rub for her hand hygiene, which is not effective in fighting the spores against C. diff. For patients that have C. diff, we have to use soap and water. Good job. Alright, so let's give you a little bit of evidence. It all started in the 19th century with Florence Nightingale. She promoted hand hygiene through soap and water, and that represent cleanliness. Hand hygiene is a vital component and preventing exposure to infectious pathogens that could lead to healthcare acquired infections. Hand hygiene is a crucial component of safe patient care, and it is the nurse's duty to ensure patient safety. So, for example, if you see unlicensed personnel going into a room that requires PPE and they're giving direct contact to a patient, as a nurse, we need to intervene and make sure they put on the proper PPE and understand the importance of preventing these hospital-acquired infections, as well as something simple as a stethoscope. Stethoscope should be clean between the use of each patient. The CDC also has guidelines and recommendations related to hand washing. Some hand hygiene products are found to be more effective than others, just like in the case study where Nurse Jackie used the alcohol hand rub versus the soap and water. The soap and water was more effective with the C. diff than the alcohol-based hand rub. So, back to the guidelines for the CDC. Does anyone know the proper time frame to washing hands with soap and water?
15 seconds. You should rub with running water and soap. 15 seconds from your fingertips up to at least your wrist.
Okay, alright. Alright, some more evidence. Death associated with hospital-acquired infections are related mostly to poor hand hygiene. Many of these hospital-acquired infections are not eligible for reimbursement, such as catheter-acquired UTIs. Those are preventable, and if your patient gets a catheter-acquired UTI in the hospital, we will not get paid for that. In efforts to improve hand washing compliance, many hospitals use the chlorhexidine gluconate disinfectant, which is known as CHG. For any patient that has a catheter or a central line, because there are also central line bloodstream associated infections as well that we do not get reimbursed for, we try to use the CHG wipes, or they have the soap. Depending on what hospital you are, they have different methods of the CHG disinfectant. Most hospitals, for the intensive care patients, they're starting to use the CHG wipes on them as well. Alright, some more evidence. Standard precaution is recommended for all patients to protect against healthcare acquired infections. Even though this is true, standard precaution compliance among healthcare professionals are below the recommended levels. So what that pretty much means is, we know we should be doing the proper hand hygiene, but for some reasons there are staff that are not doing them as often or as frequently as they should. Why? Some reasons, they may not have access to the hand hygiene. Other reasons I researched and found it may irritate their skins. For me, when I first started using the alcohol-based rub, it dried my skin out really bad. However, I still used it. Another reason could be stress related to acuity of the patient and staffing. Sometimes you may have so many patients that it's just one less step they try not to do in order to get the job done. But this in turn affects the integrity of the team safety, the patients, and the work environment. Intervention. Some interventions that we can use is alcohol-based sanitizers or rubs, use of the CHG wipes, plain soap and water, of course. Education is key. Education on the effectiveness of proper hand hygiene. A fun fact that I found was rings. Rings affect the effectiveness of proper hand hygiene. They are associated with a higher number of bacteria in the hands, especially if the ring has stones or if you wear multiple rings like a engagement ring with a jacket or a band accompanied by that. Some other interventions are improving hand hygiene compliance. We talked about how some staff cut corners and don't wash properly in between patient care. Following the guidelines, that's the CDC guidelines, washing under the running water for a minimum of 15 seconds. If you take the time out to wash your hands, you need to take the time out to do it correctly. 10 seconds is not enough. Some other interventions, washing before and after contact with the patients. And sometimes during, like the scenario with Nurse Jackie, there was an opportunity where she needed to wash during interacting with the patient. If you ever come in contact with any bodily fluids, you need to wash with soap and water. Immediately after removing gloves is another time we will wash, and after touching the residents' or patient's belongings. Any questions?
No.
All right. So, achieving the goal of infection control. One thing we could do is utilize the proper PPE. We use standard precaution with everyone until we know of any known infectious disease, and then we utilize the proper PPE with that disease. Preventing the spread of infection, adherence to hand hygiene guidelines, compliance, of course, and cost effectiveness. We talked about the hospital-acquired infections with the catheter-associated UTIs. If we have a patient that gets this, the hospital will not get reimbursed for that. Thank you. And these are my references. Do y'all have any questions at this time?